Good afternoon, everyone. My name is Brandon Holmes, Director of Marketing and Communications here at My Brother's Keeper. I'm honored to be your moderator for today's National Black HIV/AIDS Awareness Day webinar, Breaking Barriers, Building Health, Advancing HIV Prevention and Care. We're here today because HIV is still a major issue in Black communities. Even with all the progress we've made, we still face high rates of infection, stigma, and barriers to care. NBHAAD isn't just about awareness, it's about action. We have to keep pushing for real change in prevention, treatment, and policies that actually work for us. Our theme says it all, breaking barriers, because too many obstacles still stand in the way of people getting the care and support they need. Building health, because our communities deserve access to quality health care, education, and resources. Advancing HIV prevention and care, because ending this epidemic requires innovative solutions, advocacy, and real conversations like the one we're having today. Now, I'm excited to introduce some incredible people who are leading the charge in this fight. They're not just talking about change, they're making it happen. Let's meet our panelists. Reverend Kamarion Anderson is a trailblazer and faith leader who has been a champion for inclusivity, equality, and public health. She's the Alabama State Director for the Human Rights Campaign, making history as the first transgender person of color in a leadership role with the organization. She also served as the National Administrator for the Trans Saints Ministry of the Fellowship of Affirming Ministries, bringing her faith, advocacy, and experience in public health to the table. She's dedicated to make sure everyone, especially LGBTQ+, individuals of color, has access to the care and respect they deserve. Mr. Jesse Milan Jr. is the president and CEO of AIDS United, leading efforts to support HIV policy, grant making, and capacity building. Under his leadership, AIDS United has awarded over $130 million in grants to organizations across the country, helping to strengthen the national response to HIV/AIDS. A lawyer by training, Jesse has been at the forefront of national and global HIV initiatives for years. He serves on the Presidential Advisory Council on HIV/AIDS and has held leadership roles with funders concerned about AIDS, AVAC, and the Black AIDS Institute. And on top of that, he's been living with HIV for over 4 decades, showing what resilience, advocacy, and leadership truly looks like. And our very own Dr. June Gibson. Dr. Gibson is the president and CEO of My Brother's Keeper and a powerhouse when it comes to health equity and innovation. For over 20 years, she's been leading the charge in HIV care and prevention in the South, especially for communities of color. She's also helped create Mississippi's first LGBTI primary healthcare clinic, Open Arms Healthcare Center, which provides prevention, clinical, and mental health services to the underserved population. Dr. Gibson, oh, sorry. Let me fast forward. All right. All right. So why are we here? This isn't just a conversation. It's a call to action. Today, we're talking about real challenges, real solutions, and real ways to move forward. Whether it's through policy, faith, advocacy, or direct community work, our panelists bring deep experience and powerful perspectives that can help shape the future of HIV prevention and care in Black communities. So let's get to it. Submit your questions in the chat, engage, and take this conversation back to your communities, because the future of HIV prevention, care, and advocacy in Black community depends on what we do together. So let's get started. How we doing, panel? You guys hear me okay?
Yes.
All right. All right. Reverend Kamarion. All right, so first questions for you. How can faith leaders reconcile traditional beliefs with the needs of LGBTQ individuals in their congregation?
Yeah, thank you so much. And let me first say good Good after morning. There we go, because it's afternoon. And a good after morning to everyone. It's a joy and a pleasure to be invited in this conversation with such heavy hitters, with Dr. Gibson and Mr. Jesse, who has just pioneered so many years of this work. And thank you, Mr. Brendan. And before I start, we're gonna have a little lesson on my name. Many of y'all don't speak in tongues, okay? But it's actually it's actually Carmarian.
Camarion.
So go
Okay.
down. I am from the deep South, Natchez, Mississippi, by way of Texas, grease and butter at the same time. Okay, do it the Southern way. But let me
All
jump
right.
into your question. When we talk about faith leaders, how they can navigate and reconcile traditional beliefs, and we really need to unpack traditional beliefs. I am a Christian Pentecostal preacher, but take no mistake when we say traditional, there are also interfaith theology as well that actually intersect in such a way that actually other communities, such as the HIV community, perhaps whether that sexual orientation or gender identity of individuals that is in their congregation or environments. And so, a couple of things that do come to mind, some might be very elementary, but we have to be reminded that we must center love and compassion. Now, when I speak about leadership in faith or fundamental traditions, if I may, I have a collar on today, so I'm trying to be on my best behavior. But your brick and mortar, your aid service organizations, your community-based organizations are considered sanctuaries. And to some, that is considered their place of worship where they receive their healing. So when I am offering to you, as it relates to the religion and faith sector, it also applies to us who have built such a sanctuary for individuals to come receive their care. So centering love and compassion, acknowledging that LGBTQ plus individual one exists. Yes, we have a current administration that has othered and have erased portion of this acronym and is now just focusing on lesbian, gay, and bisexual. But I want to tell you, as a Black woman of trans experience, if it had not been for my sisters who pioneered the movement, you can't erase us because we started the movement. So that means 1 + 1 is 2. T plus T equals LGBTQ plus. You understand where I'm going.
All right.
Also engaging in appropriate theological reflections, considering that theology or the perspective does include LGBTQ plus individuals, including our HIV community. And also important to practicing these listening skills. I go into many of faith spaces and they already have it figured out based off their learned behavior of theology. And really, it's not listening to the
Right.
individual. I often say, and I know we're at time, but I often say that if you are paying your money in that congregation, whether that's tithes and offering, talents, or what have you, then you are also in position to tie your voice to that leader to make sure they understand that their theology does not hit or mix with their lived experience. And then we also have to talk about what most will call pastoral care. Now, let me just be the first to say pastoral care is more like chaplaincy. We're here to support. Most of us are not certified to diagnose. Okay, so I can't just prescribe oil on you without understanding what your needs are, and yet alone understand who you are as an individual. What am I really praying for or supporting you in if I can't recognize your sexual orientation, gender identity, or those other intersectionalities? So reconciling really just the basic fundamental of love and compassion and seeing someone for who they are and their intersectionality does not require us to abandon our faith and what we're teaching. It is really reflecting on the radical love and the inclusivity that we are
Right.
promoting as we call congregational faith.
Okay. Thank you for that. Jesse Jr. All right. With the recent executive orders from President Trump seeking to eliminate DEI initiatives, and with the new Congress bent on downsizing government spending, what advocacy approaches is AIDS United in taking to keep the government focused on ending the HIV epidemic for Black people?
Well, thank you, Brandon, and thank you to my brother's keeper for setting up this important conversation for National Black AIDS Awareness Day and for inviting me. I'm thrilled to be here. As you said, I'm the president and CEO at AIDS United, and we are a national organization focused on strategic grant making and capacity building for the epidemic, but especially on policy and advocacy. And I'm really proud of our team, and Dr. June Gibson is on our board. I'm really proud of our team for being a premier leader for addressing Congress and the administration. I think it's important for us to remember that because the largest percentage of people living with HIV and vulnerable to HIV are Black people in this country, the entire federal portfolio of HIV programs has a significant impact on us. And it's important that we think about it in a different way as we approach our advocacy. And I think in this administration, we have to remind them that HIV/AIDS has always been a bipartisan support. It has always received support from both Republicans and Democrats. I was sitting on my couch 20 some years ago when watching the State of the Union address and saw President George W. Bush in the State of the Union announce the PEPFAR initiative. I almost fell off my sofa. Fast forward, and I was sitting on my couch in 2018 when President Trump, in his State of the Union address, announced the Ending the HIV Epidemic initiative. So whether you look at those two just big examples of Republicans supporting HIV/AIDS, or going all the way back to the creation of the Ryan White program in 1990, which had massive bipartisan support, and the Minority AIDS Initiative, which has been reappropriated year after year after year from both sides of the aisle. I think we have to remember that HIV/AIDS has always been a bipartisan issue in Congress. And so we're going to make sure that we reach out to both Democrats and Republicans this year to help remind them that they have always supported HIV/AIDS, and that by supporting HIV/AIDS, they're supporting the health of their communities, but also helping to make sure that the people who are vulnerable and living with HIV live long and healthy lives so that they can be productive members of their communities. This is an economic as well as a social justice issue, and that's a reframing that we intend to do this year. And I also think we have the opportunity for supporting the largest AIDS advocacy event in the country, the oldest AIDS advocacy event in the country. It's called AIDS Watch. It happens every year that AIDS United creates, and it's happening this year in Washington, D.C. on March 31st through April 2nd. It is your opportunity for coming to tell Congress directly what is the impact of federal investments in HIV in your life and in your community. AIDS Watch last year had over 500 people attend, and in one day, we did 240 meetings with Congress. And 2 days later, Congress backed off on cutting $767 million of the federal commitment to HIV/AIDS in this country. So we know we can make a success. And I think it's really important that we tell our stories and make it clear that the impact of federal investment is certainly about our lives and our wellness, but it's also about the health of this country. If we want to make America healthy again, we need to continue our investment with HIV/AIDS. And lastly, our Public Policy Council at AIDS United now has over 60 organizations, including my brother's keeper, who band together to make sure that we have one huge organizational voice to address both Congress and the administration. And we have recently added a new organization, Ribbon Consulting, which is managed by two Black women who want to make sure that they're part of the structure for addressing Congress and the administration. So our advocacy is multifaceted. We can bring the stories directly to Congress. We can bring the power of HIV/AIDS organizations, especially Black-led organizations, together so that we have one voice, and we can remind Congress they've always supported HIV/AIDS and they need to do so now.
Good. Dr. Gibson, I saw you nodding your head. You want to add anything?
I think just is the timeline is really important. I think the idea that we're here now when we've had both Republican and Democrat support for this is, this is the thing that's it's confusing to us as a group of people, as a group of providers, advocates, that for so long we've lived in a world where we knew we had some level of federal support. And in particular, when you're from a state like Mississippi, you don't have state support. And so you lean hard into the federal scope of things and the federal world. And so to be here now with this particular, I really, for the life of me, can't figure out what's the hyper focus on HIV. It was like the first one in. So I think with Jesse's point, we've had this for so long, and now you're trying to move us backwards. I think that it's a complete injustice to who we are, the people that we work with. And again, we have to lift our voices with this, and we have to let them know, and we have to continue to fight.
Good. So I'm gonna follow up with you, Dr. Gibson. So as the CEO of NBK, how are you able to navigate major systemic challenges in healthcare? What's one barrier you have successfully broken down, and what barriers are still ahead?
It's amazing that if you would have asked me this question 6 months ago, my answer would have been completely different.
Yeah.
Now I'm in a world where the systemic change that I was able to kick down, in all honesty, was the community-based organizations' active participation in healthcare. There was the notion that you had to look a particular way to be able to provide healthcare, and the ideas that we had about you could do this, you could be a prevention organization who could go into clinical work and still do an excellent job. Over the years, there were so many battles for me. Either they didn't want us to provide the service, they didn't think we would be competent at the service, they couldn't figure out how we were going to have the doctors, but we broke through that barrier by understanding the actual system. We understood where dollars came from. We understood 340B. We understood billing. So we merged three active acts of monies to be able to support the organization. And so we broke that barrier. We said, not only can we provide the care, I can do it without the normal resources, without the ways that you go through it to be a community health center. I could really be a community-based organization, stay a community-based organization, and not have to go into the confines of HRSA. I could just be me. I think now in this system that we're in, I think the system change that we're going to have to make is we're going to have to be less dependent on the government. But how do we do that? How do we make sure that we create a system where this can never happen to us again? We have to find other sources of funding that makes us solid, where no one can waver on us again. This is truly a gut punch to a community that has worked hard to provide services, to grow ourselves, to be better, to be self-sufficient. So I think as I move forward now, the system change is that I want to do, it's going to be making sure that others outside of the people we typically work with for funding understand what we do, how we do it, and shift the system of how we're funded. We need to have other support, others who think about what we're doing. We need to be more included in other chronic pieces. You can't just push us off to the side. We're not just HIV, we're chronic. So I think, again, in the past, it was just making sure the community-based organizations could be heard. I think now it is making sure that the HIV community has a broad footprint in all of public health.
Good. Anyone else? Okay. So we're
I'm
gonna
sorry,
switch
I
to
didn't get off mute fast enough. I was just want to just add, as we are talking about the federal funding, let's not also forget in our backyards our municipal funding that also can be very beneficial to those organizations and institutions that provide these level of services. I mean, if I do a poll, how many of us actually showing up to city council meetings with this message to really advocate of some of their dollars that really could, because it's their constituents as well. So I just wanted to make sure I uplift that, state dollars, municipal dollars are also, right now because of the federal threat, are also being restricted, that don't have to be. They have some level of autonomy, and we need to remind them of us putting them in office of doing the right thing, which means that to keep our constituents and our residents thriving, even in the intersectionality of their race. I'm talking deep South here, okay? Race, their socioeconomic status, but more importantly, also their health status.
Right.
Okay.
And I think Dr. Gibson is absolutely right. We do need to continue to frame HIV as a lifelong chronic disease. Um, and in the last few weeks, with the freeze on international aid, we learned that on a daily basis, over 200,000 people get their HIV meds through PEPFAR clinics. But the risk that we learned on that day was if you don't get your meds, and I can attest to that, if you don't get your meds, your viral load spikes up and you are headed toward AIDS and death. And so the fragility of our lives has to be front and center because we are on these forever. And if the government isn't going to be there, we need to make sure that someone supporting the lifetime health and wellness of our community is behind people living with HIV too.
Okay. I'm gonna come back to you, Reverend Kamarian. So what challenges and successes have you experienced as an ordained minister advocating for LGBTQ rights in the context of HIV prevention?
Yeah, thank you so much for that question. And I know it's lumped together because we know that the data tells us, where LGBTQ plus fit into this epidemiology of being high risk. But in my context, sometimes it's needed to separate the two because I do not want to add to this misunderstanding that everyone that is part of that community, sexual orientation, gender identity, or whatnot, is also HIV reactive. Let's just be honest, okay? That's the stigma. But when we talk about challenges, in the faith arena, we have faith-based resistance. Many religion communities still struggles to fully accept any identity outside of Adam and Eve. I'll just say it like that from a Christian's perspective, and not understanding the scope of sexual orientation where they are in your choir and they are on the organ and they are your pastors. Can I just be real? I've been around for a while. I've had these conversations. I've seen some things, and so even trying to reconcile what's done in the dark and bringing it to the light is so essential as it relates to making sure that everyone is represented. And also the difficult gaining support around HIV prevention in these places of worship because of stigma, misinformation, and disinformation. Persistent stigma still surround both HIV plus the LGBTQ plus identity community. And so that sparks barriers. It doesn't allow for courageous and open conversation, or it does not lead to knowing how to find effective preventive services. When I am traveling, I see a church on one corner and oftentimes across the street, some type of service that is offering HIV care. And neither one of them are speaking to each other, and they're right across the street. Matter of fact, they have some of the same laity that frequent the church, but also that frequent that clinic. And they do not, integrate with each other. And then again, I always have to bring up this balanced theology where theology should be used as a tool of advocacy, navigating the intersectionality of faith and public health, which requires us to address that over our pulpits or over the mic of concerns of promoting what we are experiencing now. We do not see compassion coming from top all the way down. So it would be our responsibilities as the leaders of these faith movements who often listen to us first before they actually will listen to a ASO, a CBO, FQHC, and you just name it. They're not listening to the outreach workers, right? But they will listen to those that are responsible for their spirits and oftentimes that controls, unfortunately, their salvation, which is a tool of manipulation often at times because it's not getting to the core of that person's wholeness. And guess what? HIV is part of that person's wholeness if you have the conversation. And then the last two that I'll say is the institutional barriers that we continue to face. Religious institutions resist policy change or refuse to engage in policy because they have this misconception that as a church, it is not my responsibility to advocate or to oppose or to support legislation. But in essence, it is your responsibility. We are called to do no harm. We are called to make sure that we are integrating with certain systems that will have an effect on our congregation, our communities. So it is our responsibility to make sure that we are talking about how the HIV community and the dollars are being affected. Because if that person dies, it is your member, it's your tithes and offering. And guess what? When you have to funeralize them, you don't know what to say. And so you call it cancer. Come on, somebody.
Right.
Come on. You call it something else outside of what it is. And then the last piece that I'll say is advocating for such marginalized communities, such as LGBTQ plus right in the HIV prevention can lead to personal attacks. I am not suggesting that everyone get up and testify that, that I am living with HIV. But what I am saying is there are ways that you can inform those leaders of those religious movements to really consider them incorporating that information, because that is the only time they might hear the information besides the commercials that we might see if you watch TV, that's really not really being effective to us, because it counteracts what's happening in commercials and movies, and it's making a mockery of this epidemic. Come on, I'm warmed up now. It's making a mockery. So it is our responsibility as leaders of the faith community to make sure we are intersecting the theology, the love, but the relevant information for someone's wholeness. I come that you might have life and more abundantly. What does that mean? That means I have to speak to you in a way where it encourages you to be able to go make sure you're taking your medication. You're going to get tested. You're going to your doctor's office. Before you even come to the altar, make the message that those services are also an altar that they need to also attend.
Thanks for that. Look, you preaching. Look at the end now. We are going to pass around the plate. So get ready.
All donations go to MBK.
Or click on the QR code right there.
Hello.
All right, Dr. Gibbs, we're going to go to innovation, okay? And we're going to go locally. So Mississippi has some of the highest HIV rates in the country. How has MBK tackled the unique challenges of HIV prevention in the South?
Well, I would have to say we looked at what we actually had in our hands. We understood the social determinants of health. And once we understood that this is how they're going to be impacted, and they're going to be impacted in a much higher rate, we looked at those elements to see how could we eliminate, supplement, and support these things. If they didn't have the income, how can we make sure you got free healthcare services? If you didn't have employment, how can we make sure you work with social workers to get to Win Job Center? If you didn't have transportation, can we not pick you up? And to bring you to a space where you didn't have to worry about discrimination. So we created a space that addressed the social determinants of health so that our people could come in and uplift themselves and become better. And so once you take that mindset to actually look at the things that impacts a person's health, impacts a person HIV prevention, impacts a person HIV care, and you look at those social determinants of health, and if you build programs around the things that ensure a person can be healthy and that they have longevity, it shifts how you provide services. It's not this individual thing that we always think about. We have to think about the systems in which they work. This is why we're having such a hard time with what's happening to us now. This is an integrated system of things. When one program falls, another program falls. If we don't get the grant money, we can't get the 340B. And now we can't get the monies for that. We can't get the healthcare pieces. If you work within the system of social determinants of health, you can shift practically any disease state for a group of people. And we focus on that for years. And it was in our prevention work and definitely in our HIV care and treatment work. We make sure that we hit all those angles. So while we do lead with sexual and reproductive health in all of our care services, all of it's followed by primary health care. So we start with sexual reproductive health and we pair it. And so that way we're able to address the whole person and the person's home. Everything about that person is really being touched in such a way that we've seen results. We've seen people get healthier. We see people who are not afraid to go to the doctor. They're not afraid of the bill they're going to get at the end of the visit. And that has been a thing that has shifted us and the communities that we serve.
Right. Back to you. So what inspired you for the telehealth and the testing kiosks, and how's that going for you?
My inspiration for those outliers, those things that weren't typically happening in Mississippi or weren't happening across the country, it's been our travels. We were fortunate enough to have a program where we travel the world and we meet other community-based organizations and clinics who focus on what we do, HIV and STDs. And we learn from these organizations who at the time were in a much, much worse state than we were in. So I wanted to know, how can a group of people who don't have support from the government, who don't have support from the community, still strive? How do you still make it through these challenges and provide services to the communities that you're dedicated to? And who knew that this was going to be something that, I mean, we really need to know. There are organizations across the world who have pennies and who are still pulling this work off. So I was inspired to do a new program, but now I'm inspired to not stop. They didn't stop. Why would we stop? They don't have nearly the amount of funding that we have right now. They cut everything off, but they still continue. So I think learning from others who are able to pull it off regardless of who is in support of them or not, that is the thing that has uplifted me, inspired me, and it will be the thing that will ensure that we will get through this debacle that we're in right now.
Okay. You
I'm
mentioned the
sorry,
global
can I offer something really quick before you
Oh,
move
sure,
on?
sure, sure.
Dr. June was talking about the social determinants of health, and even in your last response, as it relates to us learning. As an activist who enjoys advocating, we are going to have to do this a little bit different, okay? And let me explain. When we talk about social determinants of health or social drivers of health, or as I like to say, the social reality of health, is that it has never been equitable to all forms of who are impacted by HIV. Okay. Now, someone that is a male who sleep with male who might have more privilege than someone who is trans identified. That trans identified can do nothing with a $10 gift card, because they're negotiating life, they're negotiating housing discrimination, they're negotiating, employment. But more importantly, in advocacy, we are being attacked. We're talking about Black, we're being attacked for our Black race. And our Black race, we've done a disservice not knowing how to show up to advocate for the intersectionality of our Black race. No one usually will take a Black LGBTQ plus, primarily someone that's trans identified, to the front line of their Blackness, because they do not know how to advocate. So if we're really going to talk about reducing, even in this time of threat, our epidemic numbers in the Black community, us Black people are going to have to be knowledge of how to advocate intersectionally. I am still Black at the end of the day. Before I walk in the room and they see this blush line, come on somebody, they see the skin tone first before they even catch my teeth. And when they do catch my teeth, that's a whole nother conversation, okay? I have a Black book still. But what I'm trying to say comically is, you got to know how to advocate for all the intersection. That's even to my people, my PWIG community, the people who inject drugs or take opiates. We cannot exempt anyone from the intersectionality of our Blackness, especially when we're talking about reducing numbers of HIV, trying to find dollars to keep this effective work going. And the best way is for us to be able to advocate the holistic of our Black community.
And this is why, Brandon, and thank you so much, Carmarian, that we have the opportunity through AIDS Watch to train advocates so that they can speak directly to decision makers. And AIDS Watch at the national level, where we speak to members of Congress, is very important. But we're going to be mounting AIDS Watch at state legislatures because, just as Carmarian said, our state and local governments need to step up to make sure that they are committed to ending HIV/AIDS. So we're going to be doing state legislative AIDS Watch, not only in Mississippi, where we always do with you, Dr. June, but we're going to be doing it in Georgia, We're going to do it in Louisiana. We're going to do it in Alabama. We're going to do it in Missouri, which has one of the worst criminalization laws. We're going to be doing it in Minnesota, California, and also New York. And this is an opportunity for us to train advocates on how they tell their own story. Just as Carmarian said, tell their own story about who they are, what they need, and the impact that government support has made in their lives. You don't have to be a data wonk. You don't have to be a legislative wonk. You are the author and the keeper of your own story, and those stories are exactly what decision makers want to hear. They want to hear from their constituents. And you know what? They're not hearing enough from people who have lived experience with HIV, no matter who they are. They don't hear from us. And if they don't, they think it's done. That's the problem we're facing. The country thinks HIV is done. I am not done. I intend to be around for another 20 or 30 years. And if you are newly diagnosed with HIV and you're only 25 years old, you have another 50 to 60 years ahead of you. We need decision makers to hear the truth of our lives and why government support is making a difference for keeping us alive so that we can be productive members of our communities. That's a level of advocacy that we are excited to do.
Yes, you hit on quite a few things as it relates to my next question to you. But as a member of PACA, what advice would you offer future members in navigating the political landscape?
Well, PACHA, the President's Advisory
Pacha,
Council,
I'm sorry.
the President's Advisory Council on HIV/AIDS, we don't know whether it's going to continue to exist under this new administration, but we are going to
Wow.
do what we can while we can. I chair for PACHA, the President's Advisory Council on HIV/AIDS. I chair the Committee on HIV and Aging and long-term and lifetime survivors. We're talking people who have been HIV positive, some since birth, and some who were diagnosed in their 20s who are now only in their 40s and early 50s. People have been living with this disease for years, and we have to continue to advocate for the resources that are necessary for us to maintain our long, healthy lives. Injectables. Does anyone know anyone who's actually getting an injectable HIV treatment today? Does anyone know anyone who's actually getting injectable PrEP? Single dose regimens, I mean, biomedical advances are tremendous, but if you don't have access to them, you don't get the benefits of them. But our legislative advocacy has to also, especially in the South, be about expanding eligibility for Medicaid, because we have too many people living in poverty who do not have the opportunity to have insurance to get everything else that they need besides just their HIV care. So expanding Medicaid is really part of our conversation, and so is getting rid of the stigma that's associated with HIV criminalization laws, which exist in more than 20 states in this country, and especially in the South. We have to get to these legislators. I'm doing one right here in Maryland, where I live, which still has a criminalization laws, to remind our Black legislators it's time for us to modernize this, because this is not helping people stay alive. It's actually keeping people away from knowing their status and from getting the care that they need.
And I will add to that, Jesse, we know that it has to change because of data. And now we're living in a world where data is being ripped and erased from our lives. So it is super important that we understand how the disease works so we can articulate those things, because again, they don't want the data to be around. They're cleaning the websites. So we know it. We know we have to change it because of the data. These are backdated ideas that are pushing criminalization, and we have to shift their brains based on where we are now. And I think that takes the community, it takes the foundation funders, it takes all of the funders to also champion this message that it has changed, and that, mind you, if more people are on long-acting injectables, it further releases us from criminalization. So I 100%, we got to keep up with the data. We cannot let this data get lost from us. We cannot let it not be the foundation of what we do and how we do it.
That's right. And we cannot erase the transgender community from the data.
We cannot. We just got them in. You know, this was a fight.
I was just about to say, you just got us in. Come on now.
Got you in.
You know, because if you erase us, then the next set of data was spearheading for our Black and brown cis women.
Yeah.
Come on, somebody.
Well, the word there's a list of words that have been taken out the NSF that you cannot use anymore. And some of the wording, I mean, it's inclusive, exclusive, bias, those things. But just as you were saying, two words that have been taken out is female and women. How do you remove female and women from the world that we live in? So it's getting more diabolical. You start with one population and then you will gradually move to the other. Well, it was gradual. 12 days this happened to us. What is 24 days going to look like?
What are 4 years going to look like?
I want off this ride. I want off.
Well, and let's and I know we're going organic here. Just come up to the table. You know, come on to the table. But when we talk about what the next 4 years is going to look, let me also encourage that I have not heard many individuals speak about. I know Age United, you guys are speaking about it because I've been on some of you guys' meetings and webinars, and I'm assuming also, you know, Dr. June. When we talk about the next 4, let's back up. We still, in the next 2 years, have the midterms. We have an opportunity here to flip Congress in a way so we are able to then reject some of the threats through voting. And then if we can get both chambers of the Senate and House, can you imagine how that will also minimize the president's veto? I'm just going to call it out. So as we are thinking about what the next 4 years look like, even in our HIV community, what does the next 2 years look like so we can make sure we're backing candidates to go in and flip who is actually advocating for us and our well-being and our health? So therefore, we do not have to go this 4 years without doing nothing. Come closer. Don't do nothing in this season. Find a way to do something. And so I do want to mention that we do have the midterms and we should start having conversation even from an HIV community. What does that look like? I know that's going to be touched on at AIDS Watch. Excited about that. But just for your own knowledge, get educated about these midterms because we have an opportunity to win somehow in the next 2 years.
Yes, it's the system. And Dr. Gibson, you mentioned in a recent interview, you said you did not break the system, but you can fix what you can. So what do you believe from a systemic standpoint that we can fix right now?
I'm gonna shift how my people look for money. I mean, we
Right.
can't do any of this without being gainfully employed. Can't do any of this. I mean, passion and love for what we do is the foundation, but we have to have the dollars to be able to do it. So I am going to shift what they're looking for, who they're looking for, intersexuality, other things that can complement us. Because while 2 years we'll be able to flip it, but what's going to happen to us in between that time? We got to survive for 2 years to be able to get to the polls, to be able to flip it. So my goal is to make sure that my people, these organizations, the people that I work with and love and care about, have the skills to be able to expand their writing ability, to be able to get other funding from other organizations to get us over this hump. So in 2 years, we can flip it and work really, really hard to reverse all the damage that's going to happen over these next 2 years.
And if I also may add, if you were asking me that question along with what Dr. June just stated, but from a visibility standpoint, we have an opportunity to keep those communities that are being erased from a federal standpoint, we can keep them active even in our backyards visible. So when we talk about our priority population, and I know it's very grant driven, don't forget that if the transgender community particularly is being erased, if Black and brown women are being erased, that leads us to make sure that even in the funding that we do have, that we are prioritizing and centering their health and also their visibility so they can stay relevant during this time of othering that the federal government is trying to implement.
And we have to shift our approach to advocacy to lead not only with the importance of social justice, but we also have to lead with an economic argument that can be heard by the decision makers today. There are still over 30,000 new HIV transmissions in this country every year. Each new transmission requires that person to be on treatment for the rest of their life. And the lifetime cost to our health system per person is over $500,000 for the rest of their lives. That's 30,000 new transmissions in 1 year. That's going to cost our system $15 billion. So an ounce of prevention can save billions of dollars for our health systems and our government. And the same is true with people living with HIV. If I don't get sick and have to be in the hospital because I have AIDS, I am saving healthcare costs. And we have got to become more conversant with the economics of our issues as well as the social justice of our issues. And believe me, with this president and this Congress hell-bent on saving money, the social justice issue may be important for us, but it's not the leading thing that they can hear the best. And we have to become very clear. This is a new strategy for us. I'm not saying we can't talk about justice, but we need to talk about economics too.
Yeah. And everyone, let me remind you guys to, if you have any questions for the panel, please submit your questions in the chat, okay? So we talked about the current administration in the next 4 years. Do we see a blessing in the sky? Do we see a silver lining for significant opportunities during this administration and possibly beyond the next 5, maybe 10 years? And that's a question for anyone.
The disaster we just had last week with PEPFAR that showed that the entire system is fragile and that 36 million people are relying on US support has shown the world AIDS is not over. HIV is not over. And we need to seize that because it's true right here in this country. If we're not careful, the epidemic will explode. So the silver lining is maybe people have awakened again to the epidemic of HIV/AIDS.
I don't know if I'm looking for a silver lining. I've been searching for one. The only thing that I see at this moment, I had a couple of phone calls over the last couple of weeks, asking me, how you doing? And I said, you might need to check on yourself. How are you doing? Are you being blinded by all this transgender language? Are you reading just the first paragraph? Are you not looking down to the bottom and see EEOC? Are you not looking to see that they have pulled the hate crime information off of the website? I mean, are you not seeing that this is you too? I think the silver lining is that there will be a line drawn in the sand. There will be groups of people who are going to be impacted by this, who thought that they would not be. There will be a group of people who will say, oh, I thought it was just HIV, and realize this is the first disease that they're going to tackle. There will be others. So I think the only silver line I can give for this day, it will create a new unity for who we are and what we do. It also will shift the types of projects that we go for. We need to change our minds about the individual behavior. We got to fix this system. This system is what led us here. And if we go back into this system again as dependents, we can find ourselves here again. So yeah, we will be different from this. We will have a different tenacity at the end of how we're going to survive this. Because mind you, we made it through slavery. We're still here. We have been out of slavery long enough to be able to accomplish the things that we've done. They couldn't hold us back. So what, 60 years of real good freedom? And we've done this with ourselves. We've done this with our organizations and our kids. So the silver line is that we're going to make it through this, and it's going to be different. And it's going to be based on our design of what this system needs to look like.
And I think for me, it's just really simple. It's a call to action. It's we need to be more active and involved in civic engagement. We need to know the knowledge. There is also an ask in this. Many of us And majority of us are very angry during these uncertain, unprecedented times that we're living in. But how do we use that as a fuel to make a future difference? I need some of us that are working in the capacity of HIV care and those that are advocates, not just by your profession, but and a true advocate that's not just collecting a check to pay bills, you understand, but those that actually have the empathy to think about what does it look like if you were an elected official. We need more Black people in our backyards to get prepared to run for office. The great start. Homeowners associations, a great practice. You got, your city council, your commissioner, you got state level positions. We need to start identifying our gatekeepers in the Black community who has been very well impressed with their advocacy skills in the streets to take what's in the streets and get them prepared at the tables that are making these level of decisions. I want to see more Black people that can empathize and take my intersectionality, okay? Do I want to run for office in the future? Yeah, absolutely. But until I get there, your privilege can actually open up doors for a person like me that is also Black. Okay, so we need more people getting involved in civic engagement. Think about running for office. There are a plethora of ways that you can get yourself prepared to do so, but we need those voices. When I look at my state here in Alabama, or let me use Mississippi as an example. You have one openly LGBTQ plus lawmaker there that is trying to tackle so much, even including HIV. He needs some help, y'all. Okay. And so, if you find yourself knowing the demographics of your elected officials and finding out that they're not speaking for our intersectionality of our Black race, then maybe that's leading you to be responsible to take the charge and be the next elected official that will take us to those tables of decisions. We need more and more. Congress Jack Crockett sitting. She needs help, and we have some others that are amazing from a federal and state, but there is always more. And if this season is not telling us to be prepared and come into unity and do our part, then we're still going to be having the same conversations 4 years from now.
Yes, yes.
Okay.
We have a question. I'm looking
Yeah,
at that.
I see it here.
Okay.
All right. You talking about what sources would you recommend?
Yes.
Okay. This is for you, Jesse. What sources would you recommend to stay up to date and also continue to learn about as far as data and research that supports the economic argument?
Well, there are many listservs that you can join, and certainly you can join the AIDS United listserv because we're going to be sending out our policy action alerts, and those will include economic impacts as well as the legislative impacts of what we're talking about. So get it to a trusted source, and I'm here to say that I think AIDS United is probably one of the best. So get on those listservs, because then you'll get updates about our response to what is happening and also information about how we're framing where our advocacy is going. And I think that's going to be very, very helpful.
And I'd like to offer that the Human Rights Campaign nationally also produced listserv primarily that focus on our LGBTQ plus community. But I also want to uplift another organization, which is the National Black Justice Coalition, that many of us, often forget about, but they are doing amazing work like AIDS United, HRC, and they're in DC, and they focus is particularly on the Black community. So I do want to uplift them as well. Guess what? We're all in this fight together, and we can no longer be in position about, where we're going to get resources. As much knowledge as we can gain, it will strengthen us to be able to show up differently. Okay. So, please find and identify those organizations. Let us not be, if I may, let me prophesy. Let us not be like the ASOs and CBOs that fight amongst each other because of personality issues. Okay. Let us come together. You who are listening on this call and those that will listen after the recording, you have a responsibility to know that the fight is being attacked. Not just people, but it's the fight. And we have to turn the other way and start unifying ourselves to make sure we're getting the information, the knowledge, the statistics, the economic, everything that we need as a Black race in order for us to stay relevant. Amen. All righty. To stay relevant.
We got time for one more. And Dr. Gibbs, this may be for you because you have mentioned this. You may have done some research on it. How do we access federally combined data that has been erased from websites?
I have been trying to figure it out myself. It's almost like I am going through my current resources to see what I have and going to look to see where it is. The blessing that's on our side is that the internet is forever. So if you Google the document, you can't go to the website and get the document. But if you Google the document, it's somewhere else. I found some in the scholarly sections on Google, but you can find the documents that are there, but they're in another space. But they have taken, they're just removed from their website, but the internet doesn't allow anything to go away. So it is there, and we will be, my brother's keeper, we're capacity building, and that is a system change. We change the organizations that we work with, their capacity and their ability to understand the world they're living in. That's going to be our system change. So even offering, we're going to be actively sending out grant announcements from other foundations you probably never thought about working with, and also offering grant writing trainings that are going to be live based, where we will actually let you write the grant during the training. So when you get back to your office, you're working from a product so that you can be more rapid. And also learning if you're going to be downsized and if you're going to have to restructure, how can you use some functions of AI to be able to do those things that you don't have employees for anymore? So we're looking at how do we keep people sustained through this period. And I think in the collaboration of the advocacy piece and the data pieces, all that together, that could hold us down for these 2 years. But again, just Google the actual document and see what you can find.
AIDSView is an excellent data source, and it probably is the most comprehensive outside the federal government. It's AIDSView, AIDSVU. It's an excellent source, and I think we all trust AMFAR because AMFAR is on the cutting edge of doing the economic and the data analysis that we need. Within a few days, AMFAR did the research to show what the impact of freezing the PEPFAR program was. So those are additional sources that you could consider using.
And then, by way of CDC, because many of us have gone to their website, they're federal, they've had to scrub their website. There is some information that's no longer available. However, I came across a website called, it's a Wayback Machine. And what they normally do will consistently clone websites to make sure that information that's once not there is still available. I'm putting a link in the chat. Sorry for the long link, but I'm on the work computer, but it should open up. And some of those items that's been removed from the CDC's website per se have been stored on this clone website that could still be beneficial to y'all. So, just another source to kind of look at to ensure that we're keeping up with information. And whatever you find, please download it, save it, because we do not know how long, this information will be able to be available before it is caught, somehow in the magnitude that the information is stored in.
Wow, we have had some church today. Now I'm about to hit you with this benediction. First, I want to take a moment to thank our amazing panelists for sharing their expertise, their experiences, and most importantly, their passion for change. Your voices are not just informative, but transformative, and we appreciate the work you continue to do every single day in the fight against HIV. Today's conversation made one thing very clear. We have the knowledge, the tools, and the power to break barriers, build health, and advance HIV prevention and care in our communities. But it's going to take all of us working together, leaders, healthcare providers, advocates, policymakers, and community members to make real change happen. So what's next? If today's conversation moved you, don't let it stop here. We need real resources to keep fighting this fight, and your support makes a difference. I challenge each and every one of you to donate today and help NBK continue this critical work. It's easy. Just scan that QR code right there on your screen, or you can visit nbkinc.org/donate. Every dollar goes towards HIV prevention, education, advocacy, and life-saving services for our communities. Even a small contribution can make a huge impact. So let's keep this movement going. We are stronger together, and the work doesn't stop when we log off. Let's commit to pushing forward, taking action, and fighting until health equity is a reality for all. Thank you for being here, for showing up, and for being part of this solution. Let's keep breaking barriers, building health, and advancing HIV prevention and care together. See you next time, and don't forget, scan that QR code and donate.